PCOS diagnosis, AMH versus ultrasound, which is better? Hi everyone, my name is Dr. Haika. Welcome back to Hormones and Health. Today we're going to be discussing about two investigations that are commonly used in investigation of polycystic ovarian syndrome, and that is the AMH blood test, Anti-Müllerian Hormone, and ultrasound. And I'll go through exactly what each one involves. Both tell us about your egg reserve, but they are measured in different ways. So let's break things down. What is AMH, anti-Müllerian hormone? AMH is the hormone that's produced from the small developing follicles in your ovaries. Follicles are the sacs that contain the immature eggs. The more follicles you have, the higher your AMH levels. Now, the problem in PCOS is that you have many follicles that are developing and they're at different stages of maturity. Therefore, you tend to find AMH levels are 2 to 3 times higher in women with PCOS. So this can be a good indirect measure of how active your ovaries are. It's important to note that AMH is also used as a routine test in fertility testing, but this video is more talking about how AMH is used in management and diagnosis of polycystic ovarian syndrome. It's important also to note that a normal AMH level falls gradually as you get older. So a high AMH level does not necessarily mean it's PCOS, and the results need to be interpreted in the context of the whole picture. Let's talk about the ovaries and ultrasound testing. So when we do ultrasound testing in investigation for PCOS, we're looking at the size of the ovary, and anything larger than 10 mils is considered consistent with polycystic ovarian syndrome, and also the number of follicles. So if you can see many small follicles, usually more than 20, that is usually consistent with polycystic ovarian syndrome. And there is this typical string appearance that can occur. Again, it's important to remember that with ultrasound, the results depend on the operator, the type of ultrasound machine being used, as well as the stage at which you are in your cycle. AMH and ultrasound for diagnosis, which can be used for diagnosis of polycystic ovarian syndrome. So to go back, the Rotterdam criteria are the criteria used for making a diagnosis of PCOS, and you require 2 out of 3 in order to make that diagnosis. The 2023 international guidelines have recognized that AMH can be used as a substitute for ultrasound. So therefore, some clinicians may choose to do an AMH test instead of ultrasound, or if there's no ultrasound facilities available, to help with that diagnosis of PCOS. Or it can also be used if the ultrasound investigations are not clear. It can be used for adding confirmatory testing. Both have limitations. AMH is not a perfect test. Not all women with PCOS will have a high AMH level. Similarly, ultrasound testing also has its limitations. For example, if you're on the hormonal contraceptive pill or if early stages of puberty. This is why it's always important to have a broad picture when it comes to making a diagnosis. Hope this was useful. In summary, AMH as well as ultrasound can be used for investigation of PCOS. Both have their limitations, but they are useful tests for supporting a diagnosis of PCOS. Hope you found this helpful. Please comment down below, and I hope you found this helpful. If you did, please like and subscribe and share with anyone who might find this information useful. Thanks.